Cathal, your Poolbeg results have been published. Can you remind us why the capital light model at Poolbeg is so unique?
Yeah, Jack, it's very unique in my view. First of all, we're capital light, we have a lot of cash. As you'll see from our accounts, with 20.9 million at the end of last year. Our plan has always been use that cash over a very long period in time. Unlike small biotechs, they raise cash, fall in love with one or two products, burn through it, raise more cash, burn through it. We reminded, and we remind the market again at the IPO, plan is not to be going back to the market anytime soon, or probably not at all. We will balance those outgoings of cash with cash as we come in. We'll manage it over quite a few years, and we're going to be a production line. I say small biotechs have one or two assets. We've gone from one asset at IPO to four, and hopefully, no pressure, Jeremy, 4 or 5 more. And then as they come in, light touch, early stage human data, and start out licensing. And our belief is we'll have out licensing revenue in the first 12 to 18 months, and that'll continue to flow. So we'll be almost like a one-stop supermarket for infectious disease as big pharma seek these IP assets. The only other company in the world with a model somewhat similar is Evotec in Germany. They've gone from a couple of 100 million to 7 billion in the last 5-6 years as they adopt it. Not saying we're going to go that far, but I think if we do this right, focus on the day job of infectious disease, focus on cash control, focus on shareholder value, I think it would be an excellent investment.
So Cathal, let's talk a little bit about share price. How are you going to address the recent drop in share price? Do you feel there's an overhang with the dividend in the species shares from the lockup in April?
Yeah, look, as the single biggest shareholder, big part of my net worth, so almost the entire net worth tied up between Poolbeg and the company was spin out of Open Orphan, and I would have 500,000 pounds sterling in at the 10p IPO price myself. So yeah, I'm not happy, not as any of the rest of us. However, I think we know we can't blame Ukraine. Everybody's using that story. That it's not helping. But yes, to be awarded a large part of the Open Orphan shareholders dividend species is unlocks on the 19th of April. I think people are unduly worried. They're free dividend species shares. However, they were strategy. HR revenue approved demerger, so it means the shareholders who will get those on the 19th have no tax. There's no income tax. The only tax shareholders will pay is when they sell them as capital gains. Next, there's a lot of them, myself included, those people won't be selling those anytime soon. And the fact that people got them for free, why would they sell them and incur a tax bill? So I think that's one of these overhangs that's probably spooking people. However, we're not going to wait till the 19th to find out if they're overhang. We have a whole series of mitigating actions, and you'll see those develop over the coming weeks and months where we'll deal with it. And more importantly, we're going to generate substantial new liquidity. You'll see from our RNS this morning that we're well advanced in having a North American dual listing. That'll be completed in Q2. So my belief is the share price is not where it is. We're going to work on it. There's going to be a lot more activity, and we're going to have mitigating actions to ensure that overhang, when it unlocks, does not cause a problem. And my belief is give us some time, and the share price will respond accordingly.
Turning to you now, Jeremy, can you provide an update on the progress since IPO of POLB 001?
Yes, happy to do. As Cathal said, not a long time ago that we did an IPO. POLB 001 was our lead asset. This is a small molecule immunomodulator for severe influenza. We've made really good strides, really good progress pushing this forward. We expect to be in a human challenge study later this year in the summer. We've identified a formulation for this product. We're GMP manufacturing ongoing. We've selected a clinical trial site and have agreement on the actual clinical study itself. It's a really good progress. So that's moving along quite well. So happy with that.
I can see you've expanded your pipeline quite significantly since IPO. Can you give us a little bit more information on that?
Happy to. I think this is one of the areas where I'm most proud of. I think we stated at IPO we were going to build a pipeline, infectious disease focused, and we've achieved that. We've hit our milestones along the way. We've in-licensed a program recently from the University of Warwick. This is an antiviral nasally delivered therapeutic and late stage preclinical. So a little bit of work to do to get it into human testing, as Cathal said, the early human testing. But a very interesting program. Of course, we're all aware of what's happened the last 2 years, and there'll always be a need for these antiviral treatments. So that's 002. We also in-licensed POB 003 as an option from University College Dublin. This is a vaccine against a tropical disease called melioidosis, and there's nothing else out there for that. There's a 54% fatality for those unfortunate enough to catch this bacteria. So again, we push this forward from a vaccine standpoint. It's very exciting preclinical data there, and a great addition to our pipeline. And beyond that, we've set up a collaboration around oral vaccine delivery, and then more recently, artificial intelligence. Again, all the things we stated at IPO, and we're executing on our strategy in a good way.
Touching upon artificial intelligence, just recently you signed your first deal with an AI company to pinpoint effective virus drugs. Can you tell us a little bit more?
Yeah, happy to. Very excited about this program. Again, we stated as part of the demerger, the spin out of Open Orphan, we have a license, we have access to a wealth of human challenge data. So this is, we have RSV, we have flu, and we have COVID-19 coming. So we're going to focus this initial collaboration on RSV, again, a pretty devastating viral disease that actually affects the elderly and the under fives. Quite significantly. So yes, working with 1-3 who take their supercomputers, they'll run their algorithms, they analyze this huge data set that we have to identify new targets and new pathways and new drugs for RSV. Very unique approach. Nobody else has the data set that we have in this area. So again, very excited about this collaboration. Just announced last week, so getting that going. But we should have early data readout in the second half of this year for potential new drugs and new targets in RSV.
Perfect. Thank you very much for the update today, and we look forward to hearing more in the future.
Super. Thank you, Jack.